We know patients who are frequently hospitalized, their quality of life is affected. And we know even in people who aren't frequently hospitalized, sometimes many patients are suffering at home with acute pain and other complications. And so sickle cell disease really has the potential to have a burden on the patient physically and the family physically and mentally and emotionally. And I think we're really starting to finally understand that the role and the impact that a mental health can have on patients. We know that patients who have mental health conditions, for instance, are more likely to have complications from their sickle cell disease. We know that they're more likely to get admitted to hospital, and we know that they're also more likely to less likely to be recognized with their mental health. And unfortunately, there were some great sessions here at ASH that pointed out that there's actually a limited number of providers who are available for patients to address their mental health care needs. While we think it's a critical component, I think adequately screening this population is a challenge. Many of them do not see their primary care doctors, for instance, and that's where mental health screening in this country is primarily done. And so if they're not routinely receiving their mental health primary care, they're not going to get their mental health screening as well, even though we know that's a critical part of that. I think there's also, mental health still remains a stigma in this country, and particularly among a minority population, which most patients with sickle cell disease are. And so really helping to identify patients, but also break down the stigma that mental health is a critical component that we need to address in order to make the whole patient better. So.